Major improvements to violence prevention and health care are coming to Oregon.
That's because a new law is set to take effect in 2026 after being passed by state lawmakers over the summer. Fox 12 investigative reporter Adrian Thomas joins us in studio now with a closer look. Good morning.
Kim, Shauna, good morning. So the Oregon Nurses Association found in a survey of its members that over 90% of nurses in the union experienced some type of violence in the workplace last year. And nationwide, the ONA says violence in healthcare settings has only been growing rapidly for over a decade. But that new law set to take effect in 2026 is meant to address these issues in a way that's never been done before. We spoke to local healthcare workers to get a sense of the new law's impact. That new law, Senate Bill 537, was passed by the Oregon legislature during this most recent session and signed by Governor Tina Kotek. It's designed to make sweeping changes across Oregon's healthcare industry to address workplace safety. Patrick Hennessy is a trauma nurse at OHSU in Portland and an ONA union member. He shared some difficult work experiences.
Unfortunately, I've been, pushed against a door. I've been threatened. I've been, called horrible, have had a lot of terrible homophobic language sent my way. I've been around where I've seen my coworkers kicked, grabbed, punched, had urine thrown at them.
The new law instructs hospitals to create workplace safety committees made up of hospital administration and healthcare workers. It also sets up a mechanism for tracking data of violent incidents and reporting them to the Oregon Department of Consumer and Business Services. It also allows nurses to only use their first name on their badge if they choose to prevent doxing and installing bulletproof glass in emergency rooms.
We really need rules in place and the state to really support healthcare workers, so that way if I wanted to work at a different hospital or go somewhere else, I can expect the same type of protections.
We also met Juliana Harder, a home health physical therapy nurse at Providence and an ONA member. She says the previously under-regulated environment of home health will hopefully be safer under the new law.
So you're literally going to a stranger's house that you've never met all by yourself. There has not been the mandatory reporting, which this bill will require a hospital that had an episode at the hospital with a patient to now share that information with a home health company going in.
Harder, who has been in home health for 30 years, loves the work she does because she likes how it allows patients to stay in the comfort of their homes if they have serious conditions. But she says it only takes one bad experience to understand how risky this work can be. One patient once threatened her with a firearm.
And I was sitting about 5 feet from a back door, and I just jumped up and ran out the back door. And I think of myself as, I've done this for decades, I'm very experienced, but as soon as I got to my car, I literally broke down crying.
Harder says after that incident, she did feel supported from her employer and that patient was dropped from her care. However, under the new law, patients who have violent tendencies will be documented and reported to any future healthcare providers they might establish care with. Both healthcare workers who sat down with us feel the mindset changing among their colleagues will be key for a safer future in hospitals, doctor's offices, or any healthcare setting.
It's surprising how we have normalized violence, because many people would, the assault or a gun was violent, but getting slapped, pinched, spit on, sexually groped, people were like, that just happens. And that has to change.
Now, we reached out to the Hospital Association of Oregon to get their response to the passing of the new law. The group is the top advocacy group in the state representing the interests of hospitals and major healthcare providers. They said, in part, in a statement sent to us, in part, quote, "The Hospital Association is proud to support ongoing efforts to address workplace violence, including supporting the passage of Senate Bill 537 during the 2025 legislative session. So really, Kim and Shauna, lots of support across the board for this new law from both healthcare workers, obviously, and the hospitals and healthcare groups that employ them.
Were you able to find any safety measures in place at our larger hospitals and healthcare groups before this new law?
So many of the hospitals in our area that we're familiar with do have private security, and there are some protocols in place where if something does happen, staff can call and there'll be a rapid response. There are also some emergency rooms who have metal detectors. Literally, it looks like airport security checkpoints, and some of are more urban settings. But really, with this new law, is it's going to make these safety measures the same across the board. So wherever you go in the state, there will be pretty identical safety protocols in place, and the fact that the state is going to now track the data when violent incidents occur, just having that as public record will be great for accountability.
Their jobs are already so intense, but to have to deal with violence, which, as she said, is now normalized. I mean, they have a really difficult job.
I agree, and I was thinking the same thing. They spend years studying and training and learning, and they devote their lives to this.
To healing.
And to feel like, and to feel like they're being attacked. We need to protect them. So thank you for telling us about
Thank you.
this.